First community conversation today, we're joined by Dr. Colin Derdeyn, chair of UVA Health's Department of Radiology and Medical Imaging. He's sitting down with Aaron.
Thank you, Steve, and Dr. Derdeyn, thanks for coming in today.
Oh, thank you. It's a privilege to be here.
Yes, we're very happy to have you here talking about such an important topic, which is brain aneurysms. So first things first, what exactly is a brain aneurysm?
So a brain aneurysm, it's a weakness in the wall of an artery. So an artery, they're the blood vessels that carry the blood from your heart. And if you put your finger on your pulse, you can feel the pulsation, the pressure of the blood in your artery. And inside the brain, sometimes over years, the pulsations of blood, the pressure of blood, the flow of it, can damage the wall, and then little balloons or bubbles can form off the side of that tube, and that's an aneurysm. So a weakness in the side or the wall of an artery.
Wow. And what are the main causes of brain aneurysms?
You know, it can be an inflammation, we think. It can be injury to the blood vessel wall. We know that people get them as they get older. And we think as many as 1 or 2% of people over the age of 50 may have one. And factors that make it more likely are people that smoke or have high blood pressure, and both of those we think are associated with injury to the blood vessel wall.
Got it. And what are some of the symptoms that may signal that someone has an aneurysm?
So that's a great question, and I'm going to digress just a little bit with that one, because aneurysms scare people terribly, because we know that when they rupture, that's often very devastating. It causes a bad stroke that's often fatal. So, and we find a lot of these aneurysms by accident when we scan them for an MRI scan or a CAT scan for a headache or something like that. And those aneurysms that we find by accident rarely cause problems, and most of them don't need to be treated. And really, the way that we find the problems that aneurysms cause almost always are when they bleed and when they rupture. So, and it's kind of two different groups. The ones we find by accident, some of which should be treated, but they're not really emergencies. And then the ones that we find because they've ruptured, and those are the ones that we treat to prevent them from bleeding again.
Got it. And what are the treatment options available at UVA Health?
Yes. So over the last 30 years or so, there's been a revolution in how we treat brain aneurysms. And 30 years ago, nearly all of them were treated with open surgery, where we would open up the skull, go to the surface of the brain where the brain aneurysms are, and then pinch them shut with little metal clips. And for some aneurysms, that's still the best way of treating them. However, over the last 30 years, with tremendous advances in how we can watch things remotely with x-rays, how the devices that we have to navigate inside the arteries, and then the things that we can put inside the blood vessels to fill them up or seal the aneurysm from the inside, they've gotten better and better and better. And so the vast majority of aneurysms now, we treat from inside the blood vessels to plug them up so that they can't bleed.
Well, that's good. It's good to know that there's, those advancements are here and they're available, and I'm sure more advancements are coming down the line. So that is good to hear. A very informative interview. Thank you so much, Dr. Derdeyn, for coming in today.
Thank you. My pleasure.
Yeah, we'll see you.